Welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Samatinos. And if you're new to us, we're super pumped to have you here. And you know what? We're pumped because we've got some really exciting conversations with some great leaders that are painstakingly shaping the future of healthcare. And we are really passionate around leadership, access, making things happen through healthcare innovation adoption. So if it's your first time tuning in, let me just kind of dig in a little bit more and tell you about what we're doing here and what we're all about. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And the aim is really bringing in talented people that are truly innovating within our space and just giving them the platform to be able to share their stories with our community and inevitably with the world. We've just got an amazing year, action-packed, filled with a lot of great interviews. If you haven't checked out any of the historical ones, make sure you hit the subscribe button now, even ring the bell wherever you're at. Just let us know. We like to hear what's going on. And as part of our commitment to just keeping you updated with the latest advancements, the latest and greatest, we've just got just an amazing, innovative leader that we're pulling in today that's really pushing the boundaries and shaking things up. And I'm honored to introduce our next guest and an accomplished leader, Sana Rockwell. So Sana is currently the Director of Strategic Transformation Management at Ascension. And she's kind of like, I'll say this, maybe she's like the MI6 or the SEAL Team 6, where she works closely with teams to create and test new opportunities with the goal of basically reshaping the future of healthcare delivery. And Sana has been very instrumental in working towards health equity, and she's led the creation and the strategy around social determinants of health while improving healthcare outcomes. I mean, she's collaborated with numerous leaders throughout the organization, nursing, medicine, finance, around basically developing a national case management model that really is aiming at providing the right care to patients in the right place and the right time. So sort of this quadruple aim. And this initial project has been projected to save up to $40 million within the first year. And she's also been part of a team that's created a premium-based Medicaid care model that's improved care management. And she supported this through partnerships within the community. And we'll talk a little bit more about that in today's episode. And she's also co-led the creation of a sustainable mental health care model, which, you know, we all know about behavioral health and the shape that is in across our country. And she's done that for individuals who are undered, as well as ones that are uninsured. So she's really, really committed to promoting diversity, equity, inclusion in both leadership and healthcare. She's just a tremendous leader. And awesome to have you on the show. Welcome.
Thank you, Michael. I'm happy to be here. Thank you.
Yeah, yeah. So let's dig in a little bit more. I mean, you've had some pretty amazing historical tours of duty, um, historically, you know, both internationally and nationally. Let's talk about, you know, from a foundational level, your view of innovation. How has it evolved over the course of your career, or has it not changed?
Did you say my view of innovation?
Yes.
Wow. Thanks for that question. That's funny. You and I are typically very in tune, and here we are. As you were introducing, I thought of that. Exactly that thought came to my head, and I'll tell you what I thought of. I used to think innovation was something big and out there. And oh no, not me. I don't know how to innovate. I'm not creative, I used to think. And honestly, now I've been grounded in wow, we can all innovate. And every little thing we do to think differently, to refine a process, to deliver something in a more streamlined way, to help a patient improve their outcome, that's all innovation. And yes, there is, big innovation, if you want to call it, but every day, each one of us has an opportunity to think differently, which is innovation. So that's really my thought as you were talking was that transformation that personally I've come to kind of realize, like, yeah, every day we innovate and we have that power to do so.
Yeah, there's this really interesting relationship between innovation and leadership. And early on in my career, I remember having some just incredible mentors that were tremendous leaders. And they said, look, leadership's got nothing to do with title. Zero. It's everything to do about, you know, who you are, where you are, and what you have the ability to impact. And similarly, I think as it pertains to innovation, it's not about title. It's got nothing to do with title. It's got everything to do with number one, internally, how can you innovate and evolve and get better yourself? And then how can that translate to other areas around you? So within those lines, let's dig in a little bit more. I mean, Ascension is a massive organization. And I think there's a lot of misnomers and a lot of myths and maybe even I'll just call it some generalizations that big organizations, there's a lot of blockers when it comes to innovation. Can you maybe share a little bit about maybe some of the things that you've been focused on and then kind of unpack some of those myths?
Sure. Let's see. Um, I'll go to the work with community impact and the leaders there. And I think one of the things that I gravitated to with Ascension is their mission, really focused on serving the underserved. The statement, says the poor and vulnerable. Some people like to say made vulnerable, but really the focus on not only people who have access and have access in a more streamlined way, but people who struggle to get access to the care they need. So that is one of the things I do enjoy about working with Ascension. And I think the community impact team and the leader who was brought in really helped align the resources in a very innovative way. So a lot of times people come in and think, oh, I need more people, I need more resources, I need this and that, and then that sometimes becomes an obstacle in terms of just getting the right resources. But I think working with this leader was really eye-opening. She, from a leadership and a relationship perspective, was instrumental in leveraging existing resources within the organization, aligning the other leaders, her peers. And my role with her was really helping craft that strategic roadmap and then leveraging the resources within the organization. So I think, and within community impact, I should explain, comes the addressing access, social determinants of health, behavioral health, as well as some specifics around maternal health and maternal mortality and morbidity. So really that work cannot happen without bringing in the clinical teams, bringing in even our nutrition services to help moms who are under nutrition while they're pregnant. So really, in terms of a myth, yes, large organizations are hard to navigate. They are hard to sometimes align on goals and objectives. And I think that's where leadership comes in, and having a leader who's able to tie in those pieces and through relationships, through influence, align around goals and then execute on it. Because you and I have talked about that, right?
Yes, yes, yes.
But what happens? Where's the action? So it's been really a privilege to work with that team and to see how we can actually.
Well, how big is that team? I mean, let's talk about size and scale of the team and what is the impact in terms of how much impact does that team have across the organization?
Sure. When I first started working with the team, it was me and a couple other like senior leaders who were basically it wasn't a team. 2 years ago, there was no team. So to answer that first question,
So you're a gang of one.
yes. And really my role within Ascension is a kind of an internal consultant, strategy consultant to help take things that are just an idea and then help grow that strategically and then grow the operations. So from the beginning of that work, we saw the link between mission and serving people who do not have access, and then realizing that the answer comes from our impact in the community, our ability to address social determinants, etc. So that was the beginning, the seed, if you would, 2 years ago. Then the chief of community impact was recruited. She built a team of maybe 4 or 5 people in about a year. And then the organization realized that there was an opportunity to align resources. So we do a lot of great things, but we do them in silos. So we have a community benefit team, then we have a community impact team, then we have a mission team. So part of what the organization did was aligned community benefit and community impact, which would make sense when you think of what they do. What that enabled without extra cost to the organization, that enabled the community impact team to have resources on the ground. Because as you know, Ascension's a large healthcare system. We have about 12 markets right now. And with people already on the ground who know and understand each market, understand the community, understand how to leverage resources within that community, we were able to quickly impact the markets or impact the communities in the markets versus having to like build from scratch.
Mm. And what's like, how do you measure baseline and versus like the actual impact? Can you maybe, to the degree that you're able to share, well, can you maybe kind of talk a little bit through that?
There's several factors. So let's take the maternal health, for example. We do look at NICU visits for babies, or NICU stays, I should say, not visits. So obviously you want to decrease those because we know the impact of on families when babies are born and need to be in the NICU, but also on the baby and long-term impact. So we are looking at morbidity and mortality rates for moms, but we're also looking at neonatal intensive care stays for babies. In terms of social determinants of health, we're looking at people's access to actual healthcare. Sorry, not healthcare, like food. So food insecurity. We're looking at transportation, medication access is another one. And housing, we are tackling that. So housing, we're in the baby stages, but typically with housing, you do look at psychological factors and people's really feeling about their life altogether. But then access to care would be another one, because a lot of times if you don't have a home, it's very hard to access healthcare and to build your to take care of your health. So those are some of the factors we look at. We are looking at the data also from a like race and ethnicity component by zip code, and really trying to understand what are the factors that impact people's health. We are looking to add to that. So obviously diabetes management. So what is it? I'm not a clinician, but I'll say A1C1 level, looking at hypertension, again, mapping that to the zip code, being able to map it to a specific clinic, and then working with that clinic in that market to say, you have a population here that you can manage better, and what can we do to help you?
Interesting. And as it pertains to like the population health aspect of it, is there a dotted line between you and that pop health team? And what is that dynamic like?
Good question. I was just on the phone yesterday with the pop health team. So I'm, again, because of the nature of my role, I pivot to new initiatives and they do tie in, which I love. So I am working with the pop health team now and the value-based care team. And yes, we literally yesterday we're making those connections, right? Because a lot of pop health is care management, but also a lot of care management is social determinants of health and addressing them. So connecting those leaders and making sure they're talking to each other and then aligning initiatives, I think is a huge opportunity that we're constantly, as a large organization with many objectives and goals, really trying to align all those efforts so that we can get the outcomes that we are hoping for.
So you've said aligning a few different times, and that's, by the way, that's my word for 2023. So there's a natural tendency for curiosity. So when you say it once, okay, but now you've said it twice, so now I have a level of curiosity around that. Talk about aligning. I mean, what is that lift like? Is that mostly communication? Is it a cadence of accountability? How do you keep multiple projects aligned, in tune, so that things actually get executed? Like take us through that. Yeah. That's fascinating to me.
Yes, and it's again, I love how in tune we are, because that is something that I'm passionate about. And I think that's really one of the key ingredients to anything we are working on. And I'll talk personally about myself. That's what I find at the magic ingredient is getting, I'll use it one last time and then I'll talk about it. Getting everybody like marching in the same direction, right? That's alignment to me. And really, um, that metaphor of the conductor, right? Getting everybody to do their part so that the symphony is beautiful. So as I think of that, for all practical purposes, it is a lot of relationship building first, right? And a lot of times people want to always get together, right? Like, oh, let's get 5 people on the phone, and you do that and you do that again. And I just feel like a lot gets lost in translation, and people do those nods, especially over Zoom, but then the action's not there, right? So honestly, one of the things that I've started to do is do more one-on-ones, even if they're like 15 minutes or a half hour, so that I can understand where the leader from case management is, and where the leader from community impact is, and where the leader from pop health is, right? And just understanding what their vision is, and then helping connect the dots between them and bringing them together with like, hey, I heard this from you and I heard this from you, and look, you're all working on this, and maybe if we can agree on a goal together and then an action plan, and start to map what's our vision collectively, what is our shared vision, and then so the what and the why first, right, and then the what and the how and then the who. So that's typically what I do with the different groups is really first aim to understand where they're at, what they're trying to achieve, then see what commonality exists, and then help them really develop that roadmap with each other so that their shared goals and vision can be achieved.
And do you feel like that's not possible, them doing it themselves? What's getting in the way of them being able to kind of do that? Obviously, you're very gifted in terms of what you're able to do, and you have a very clear focus. And then it also helps when you have like, GSD out the wazoo, getting stuff done. Where do you see leaders getting off track?
Yeah, another good question. So I think for some leaders, it comes more naturally, and they probably need less of someone like me to come in and support the work. I think where it gets more challenging is when there are competing priorities, right? And there's in healthcare, and I'm sure many other industries, there's always fires to put out, right? So you want to do this, but then COVID hits. You want to do that, and you have shortage of nurses, and you want to do this. So then it's on your mind, but you have less time to focus on it. You have less capacity, and you really want to reach out to your peer, but you know what? Somebody else needs your attention right now. So, as well intentioned as everybody is, sometimes those missed opportunities don't allow us to have those conversations. And then because everybody has so many other things on their plate, it becomes, the priority is whatever. What is it? There's the urgent but not important, or something like that. So, or not strategic. So there a lot of times we're addressing what's urgent but not necessarily what's a strategic priority. And I think having a kind of a little assistance with, hey, let's come back to what's strategic. Let's take perfect example. I'm working with the pop health team, as I mentioned, and they are doing tremendous work. I mean, I have read hundreds of slides that they've put together to from current state assessments to evaluations of strategic or sorry, not strategic, but of contracts. Yet nobody, like when I asked the question, and this is not a criticism at all, this is just a aha moment that I had last week. when we were talking strategically, we took a moment to step back and say, okay, what is our story? What are we trying to do here? I asked about what are our short-term and long-term goals, and they weren't articulated yet. And that's okay, because that's the process we're doing right now. But that's an example of how often we delve right in, especially if that's our forte, right? If you're good at getting stuff done and you know your stuff, so you dive right into the work. But you need to be able to step back and just articulate what am I trying to achieve, and how am I going to get there, and who do I need to help me? And those are the interdependencies, and then that becomes the let me reach out to that leader. So a lot of times we're reacting versus proactively creating what we need to achieve. So I think that's what gets in the way, just kind of a lot of firefighting, and then a lot of operational needs that are more urgent but not necessarily strategic.
So I have a question. When let's just say you're starting out the year and the organization is rolling out goals and key areas of interest and objectives. I mean, how many goals are rolled out? And then those goals, do they have sub goals? And how many goals does that actually turn into? And when does that start to become like noise?
Yeah. So in general, I'll just say what I've seen in organizations is a lack of clarity on goals and a lack of cascading goals. And I think that's probably where you've seen some similarity. And I would say that's part of the problem in terms of the execution, right? Because when you're not clear on the goal and what needs to happen, and then the cascading of that goal and how that would work from a national level, and then a cascading down to the markets and then to departments. So in an ideal world, I think that we would have, I'm not going to use the word, Michael.
Go ahead.
We would have more aligned goals, right? that maybe are not top down, but can also be bottom up, and somewhere in the middle where if we're saying, let's just say as an example, I'll talk general, I think that's better, but let's say if an organization wants to focus on addressing social determinants of health to improve outcomes, right, which also improves your quality goal, which links all along and improves your financials, etc. Well, we say that at the top, but then we don't we don't cascade it down, and we don't ask the different departments or the different facilities to match that goal. And then if we don't do that, then we have a goal up here and they don't have that same goal. And then they're not asking for the resources they need, right? So let's say we need a community health worker to help address social determinants of health in a certain facility. Well, if it's not strategically identified as a priority, then it doesn't get resourced, then we don't achieve our goal that we said we would at the beginning of the year. So I think that's why for me, the word has been the alignment, because I see what happens when we don't. And then that creates a lot of confusion within any organization in terms of what's a priority and where are we putting our resources.
I couldn't agree more when it comes to unmuddying the waters. I've seen this often. I call it the OG effect, overgoal. You got overgoaled to death and nothing gets done.
Yeah.
And my question then is can you deduce down the goals into like 1 to 3 main key themes, objectives, and key measurements around that? And I think it varies from situation to situation, but it's just something that I've seen.
Yeah, so I'll use a example. I think I got my master's in healthcare transformation at UT Austin with the Value Institute for Health and Care. And one of the case studies, it wasn't in the US, I think it was Sweden, but don't quote me, it was in Europe somewhere. What was striking to me in that case study was so 2 things. One was these bunch of hospitals came together with a very different objective. What I've seen often in the US especially, and I'm sure happens everywhere, but really what brings facilities, hospitals, physicians together is financial gain, which there's nothing wrong with that. We all need to survive financially and be sustainable. But I think when we just focus on that, then the synergies and the focus on the patient really dissipates. So what was unique in this case study that we read about is, and I can share some information after this, is this group of hospitals actually came together with a stated objective to improve outcomes. And with that, their strategy was to look at their data across all the hospitals and align their strategy to the data. So if hospital X has low performance or unfavorable outcomes, let's say with cardiology or cardiac procedures, and hospital Y is doing really well, even though there's a loss of revenue to hospital X, they diverted the procedures to hospital Y while they fixed the program in the other hospital. And then they created these learning environments where physicians and clinicians could learn from each other and actually provide, feedback in a psychologically safe environment. So I think when we talk about goals, we always talk about using data, and I love that. I think that there's different levels that we can use the data. And I think if we can start at the top and look at our organization as a whole and look at our performance. So we always have these lofty goals, OG, right? Of we want to improve quality and we want to improve finance and we want to improve everything, access. And then we silo everything. And then we say, okay, you go fix sepsis over here, and you go fix access over here, and you go fix social determinants of health over there. Yeah, really, a lot of times, if we can actually look at our numbers and say, oh, in facility X, we have a huge opportunity to work on heart failure, right? Well, then let's get the right group together. Let's see what the root causes are of this problem. Which that's innovation right there, right? When we think differently about how to solve a problem, right? And then let's get the right teams together, whether it's a data person, it's a project manager, it's a physician, it's a nurse, it's the, strategy person, whoever we need to like wrap around this problem and get the outcomes we want. So I think from the, can we make the goals, can we have less goals? I would say absolutely yes. I think having data-driven goals that then get cascaded and strategically worked on would better serve, and then would not have we wouldn't have as much burnout, right? Because people always feel like here's another project, and they want us to work on this, and that. Well, what do you want me to do first? Like that's often we get that, right?
Well, how do you prioritize? How do you do that now?
Oh, let's see. So there's ideal state, and then there's what happens. I think often ideal state is you have a strategic plan that is revisited, annually, but really it's a 3 to 5 year plan, usually 3 years now. And we do revisit annually. And the hope is you don't change much. The hope is you it's an opportunity to like just step back, say, okay, what have I achieved as an organization or as a department? And then do I need to stop doing something? Do I need to continue something? Or do I need to think of something new if it's not working? Or has something else happened that we need to add? So I think ideally that's how you prioritize, and then you stick with your priorities unless COVID hits or pandemic.
Yeah.
In reality, I don't know that we're that focused, right? Because again, there's a lot of understandably so, a lot of firefighting in general in healthcare because we have a lot of levers that are being pulled. So I wouldn't say that it's that focused, but I think there's an attempt to focus the efforts, and then to in between we do have check-ins. So we're getting updates from the different strategic implementation teams, and looking at our data and our outcomes that we identified. But they're still OG'd.
So I know, look, the blessing is that you talk to a lot of different teams and you can kind of immerse yourself into a number of different environments. How how would you say the sharing of best practices works within within an organization like Ascension? What does that level of collaboration look like?
I think Ascension has been more and more intentional about getting leaders together to share best practices, which is really encouraging. Um, and I think they're using a good blend of um, virtual and using that as a
Right.
tool, but also in person, because there is value to coming together, building
Totally.
relationships in person. So I think they're doing a great job. And then they call it an ops intensive. So there's certain topics that are picked every quarter. So case management was highlighted a few months ago in Chicago, actually, I think was the meeting. But really that gave the leader an opportunity to share with their peers and all the leaders within all the markets. Hey, here's what's priority for the organization, and here's why, and here's what that means to you. And here's what we need from you as a leader to work with your teams. So I think they're doing more and more these intentional sharing sessions. It's a balance because it's such a big organization. Nobody wants to be on a Zoom call for 3 or 4 hours while they learn about what everybody else is doing. So really just finding that balance where you at least share enough information, and if there's interest for more, you can either do a deep dive with your peer, or bring it back next meeting. So it has to be done by design, versus it's hard to have it be organic in
Yeah.
this world that we live in.
So I mean that's what I would call, top down innovation. But at the same time, there's a lot of bottom up innovation going on. And since you are exposed to a lot of different teams, is there a common theme as far as what what frontline workers, I'll call them the people that are really doing the work, what are they excited about? What areas do they want to improve and innovate in? And are there any themes that you've seen across this year and going into next year that you're personally excited about?
Let's see. It's a good question. What I think often when I work with the frontline team is what excites them is taking care of their patients, hands down. Like, don't talk to me about whatever technology, or not that technology is not important, not that they don't need technology to help them get their job done. But what excites them is get the obstacles out of my way so I can take care of my patient. Or so I can take care of my work environment so that the patient can get the care they need. So I think as we work with frontline team members, let's say case management, we were in one of our facilities, and one of the things we really are trying to standardize and hone in on is multidisciplinary rounds. Why? Because it is the best practice. It's been around forever. It's not a new thing. But when done correctly, when the right people come together, multidisciplinary, pharmacy, physicians, nutrition, nursing, case management, you name it, all of them. And when it's done in the right way, effectively, respecting everybody's time, you communicate, you know what's best for the patient, and you're ready for the day, and giving your patients what they need and making sure that their needs are met. So in the end, really what these frontline caregivers want is make it easy for me. So if there's a tool that I can use and know what my patient needs, and when they, what's their barrier to going home? Because all they want to do is to go home, but we can't send them home because they need a walker. I'm making it up, but you know what I mean? So that's what gets
Right.
in the way. And just make it easy for me. Like make my job easy so I can take care of our patients. So I think for my view as a leader in healthcare is I think that's one of our key jobs is how do we enable our caregivers, all of them, and I use the word caregiver broadly, to do what they love to do, which is take care of their patients.
Yeah, in essence, how do we help the people help the people?
Yes, spot on. Exactly.
So, I mean, talk about tech. There's just sort of shifting gears a little bit. There's so much that's out there, and there's a lot of noise. How do you sift through the noise?
Um, I think listening. Um, and I say that in two ways. I think listening to the end user. So if the end user, whether it's the patient who's going to use the tech, or it's the nurse, or again, it doesn't matter who, but you listen to the end user first. And then when I've been part of selecting, for example, a technology or a partnering with a technology vendor, um, really also listening to them and listening to what their goals are and their culture, and does their culture match ours, and how do we work together, um, and then in terms of compatibility and interface. And again, making it easy. Nobody's going to want to sign in here and then sign in there. Nobody's going to want to go into another system to get the information they need. So looking at how streamlined the process can be, looking at how user friendly it is, and then making sure that whatever the technology offers matches what the end user is looking for, and that they can use it. Like ultimately, right? Technology is only as good as if the person is able to use it.
So when you're deploying something, it's called an external innovation that you're bringing in. How do you set up? I'll just call it these experiments. The duration. What are you looking at from a usability standpoint? And then is there something financially that you're like, hey, we need to get certain percentage of ROI in order for us to like really deploy the system wide? Talk through that again to the degree that you're able to.
Yeah. Um, I'll talk about it more from when I was involved with patient experience.
Yeah.
And we did deploy a rounding tool. And I think, a lot of times, and I'm guilty of it, you see technology as the end all be all. It's going to save everything. And, reality check, it won't. It'll only be as good as when people use it. And so as we do that, part of what we negotiated was a trial period first. And that was built into the contract. And I can't remember. I think it was probably 3 months, which would be reasonable. And then, of course, start small. So this has been 6 years ago or so, but I think we started with 2 units. And um, on the flip side of that, working with the vendor, of course, but on the other side is working with the leaders and their teams who are going to actually use the tool. So engaging them from the very beginning, getting their perspective, understanding what's important to them and what gets in their way for using any tool, and then making sure we collect data pre and post. So in this specific example, it was our patient experience data, but it was also more so than like the survey, but it was also the number of complaints we would get from patients on that unit, because that's real time data versus the 6-week lag with the HCAHPS. So we did track before and after number of complaints, number of compliments. We did track the like associate engagement or nurse experience specifically in that situation. So I think starting small, building into the agreement that there'll be a pilot time frame, and then expanding slowly, and sticking with it. honestly. Like, so again, often it's like, here's
How
the
hard
thing.
is how hard is the stickiness of it though? Because you mentioned aligning, so you're doing a lot of that work in the up front. But is there an element of creating that stickiness that helps it continue to sort of stay over prolonged periods?
Yeah, I think that's, again, people process technology, right? So the people piece is the leadership piece.
Yep.
And then the trickle down from there. But the leadership in terms of if you build the accountability, then the sticking with it is easier. There's still going to be an element of tracking. So you can get reports on how many, that's in this situation, how many rounds were done. And you can celebrate when there's success. So that's, you reinforce the behavior you want, right? So just like having kids, as you know, so you reinforce the behavior you want, you celebrate the wins, and then when something is not working, you seek to understand why it's not working. You partner to address the obstacles. So I think the sticking with it in my mind is I'm reminded of that flywheel in From Good to Great, right? In the beginning, it's harder and it's a lot more hand holding. And then it becomes a process, a natural process with check ins, with um, continuous kind of communication, but not as hard of a lift. It becomes the lift is done, and then it's just more maintenance at that point.
And I kind of want to, I know we're getting towards the end of our time together, but I just thinking about how do you all celebrate wins? Because I think it's all about like the next thing, the next thing, the next thing.
Yeah.
What is something that is memorable to you when you guys when you and the team did accomplish something? Like what was that celebration like?
Yeah, good question. Um, so what comes to mind, and this is just an example of it does not cost much. It's not because again, often the pushback I get is, oh, what's the budget? And I remember putting together a budget and it was a joke in terms of the money that the organization spends. And this is a different hat, not my Ascension hat. This was my previous life. Um, but I'll tell you, people appreciate the gesture, right? And more so, they appreciate being seen and knowing that the leaders within the organization and the culture of the organization is one of appreciation and gratitude. So you'd like to think that it happens organically, but again, everybody has really good intentions and want to go out there and want to spend time with their team, but you get called into a meeting, you get
Yeah.
crisis, you get, something going on in the emergency room, and it doesn't happen. And because we're human. So by design, for example, we did quarterly celebrations and we would look at the data, look at the progress that has been made. And it was me and two other people, but it was so fun. We would go out, Pinterest has saved my life. I'll just put it out. I am not very creative when it comes to those ideas, but things. I mean, we bought 100 grand candy, my favorite, and there was some slogan that we use, but basically thanking them a million thanks, right? And baskets of 100 grand with a certificate of achievement. And we had the CEO, the CNO, the COO, pretty much any leader who can be there, plus the director of the department. We made sure that we went at night as well as in the morning, or day shift and night shift. We covered both shifts. So we came into the hospital at whatever it was, 10 p.m., and made sure that we celebrate everybody. So I think those are memorable because the people connection. And it used to
Yeah.
be like, oh, patient experience, and then it was, hey, how are you? Oh, thank you. And so I think, and it wasn't the money that you spent, but the effort, and then the presence, being there and having people see the leaders invested in their success was a big hit.
Yeah, so when I just thinking about you, your role, what you're doing, I view you as the glue, the bridge, the connector, making things happen, not necessarily having to be front of the house, but you're like back of the house, making sure things are really moving forward. And let's just say we're sitting down a year from now and we're
Yeah.
looking back. What what would make you really happy? Like make your soul happy. If you're looking back, what would need to happen to make your soul feel really fulfilled with what you all got accomplished in that year?
Huh. Let's see. Hmm. I would love, from a healthcare perspective specifically, I would love to see us improve access to care and specifically primary care. I would love to see, talking about the right care in the right place at the right time. I
Yes.
think the number of people who end up in the emergency room and get intermittent care breaks my heart. Um, and we keep pushing back in the U.S. on healthcare for all. One of my mentors and professor at UT Austin, Scott Wallace, would say we do have healthcare for all in the U.S. It's just backwards. So we'll let you come to the ED and wait 6 to 8 hours and get really expensive care with no continuity, but we won't let you have a primary care physician, right? Who can give you continuity of care, who can manage your diabetes better, who can manage your back pain so you don't end up, debilitated and not able to go to work. And you can't afford a physical therapist, or you don't even know how to access a physical therapist. So for me, seeing our healthcare system really kind of, I know it's going to take time, and my kids have taught me a lot more patience than what I started with. But I think if I can see us switch that model to a focus on getting people the right care they need and starting with primary care that as a foundation, and then we can think about specialty care. But that to me would be success and would make my heart really happy.
Amazing. Well, then, how is the community? How can we help support you? How can we add value to you?
I think more conversations like this, Michael, right? Because we
Mm,
need to be able to have this dialogue. We need to get like-minded people together to create this momentum, and that has begun. And I think that gives me a lot of hope. And really, the space that you've created to have this dialogue is um, just really invaluable. So thank you.
you bet, you bet. And then maybe just to kind of wrap up, like give a little commercial for what for about you, what you're working on for the organization. How can we follow your work?
Um, so I am getting better and better articulating my passion, and much of it is through our conversation. So thank you. But
You
really,
bet.
my passion is access, and I think that's what brought the two of us together. And rethinking value-based care. To be honest, I see a lot of focus on just the payment piece, but not the care model piece. Everybody wants to go to the Excel sheet because it's easier and you don't have to deal with the sticky people that get in the way. But really, it has to start with care revamp. It has to start with our care model and how thinking about how we deliver care. So I think for me, that's going to be my focus. That's going to be where I would love to grow more and build community around that. So yeah, I'm on LinkedIn and I'm getting more and more vocal there. And through your forum, the AHI would like to be more in touch with like-minded people and have this dialogue.
Amazing. Dana, it's been so awesome to just hear you, hear your stories, hear your experience, and listen for those that have tuned into this conversation. Listen, y'all, can you please share the love, engage, like, comment, subscribe, share it with your family members. You know, people that care also know other people that care, and it's important for the work that we're trying to do to get it into the hands of as many people as possible that care, so we can make stuff happen. So, Dana, I'm looking forward to next conversations and having you on again at any point in the future. Door's always open for you.
Thank you. Thanks, Michael. Thank you for this
You
time.
bet.